this is a clear call, a wake-up call to us to do our best to remedy the situation. We can get to that point too, where medical professionals want to stay here and work, want to earn their living, want to contribute to the improvement of the delivery of Medicare in our country. But the situation is there. And it doesn't encourage a lot of these professionals to want to stay here. 8 out of 10 medical doctors sampled indicated that they would want to leave Nigeria and go and work abroad. A situation in which the base salary for a medical professional in the UK is £4,000. You know, there's no way that people want to go there. Look at the value of our currency now. Look at even the cost of living. So, as long as certain things don't improve in our country, there is really nothing we can do about this. And that's the essence of this whole discussion. What can we do? I'm sure Theophilus and his team have done some studies that clearly show where the problems are, you know. So as patriots, our duty is to show what the problems are and nudge our government.
Based on the info available
to us, and nudge our government to address this problem so that we don't get to a point in which the whole health system collapses.
Theophilus, a natural question to ask at this point is, when would you say this trend of health workers emigrating from Nigeria became so concerning?
Well, there's always been that movement from Nigeria to other parts of the world. And I want to mention that it's not just leaving Nigeria for other parts of the world that, we have discovered. Health workers no longer want to work at primary healthcare centers.
Within the country.
They want to move from rural, health centers to general hospitals, and then those in general hospitals are always struggling to move from state-owned hospitals to federal medical centers. So we now discovered that because of insecurity in some parts of the country, like Niger State, we studied in Niger State. We discovered that insecurity, made so many nurses and midwives to abandon rural primary healthcare centers. So we are not just talking about even leaving this country. Even access, for those in rural areas, having access to quality medical care is a problem. We have discovered that less than 50% of women who give birth had midwives, birth attendants to really actually attend to them. Less than. And then we discovered that, you see, the movement from Nigeria to other parts became more serious in recent years. For instance, in 2017, we had 26,121 male doctors and 13,791 female doctors. But as of 2019, the thing had dropped to 16,006 male doctors and 8,634 female doctors. Now, in 2024, 2022 rather, sorry, we are now talking about only 24,000. As of 2019, we had more than that figure. But now we have only about 24,000 medical doctors in Nigeria. So it's something that should be disturbing. And my worry is that, we are talking about 2023 elections, and specific issues like this are not being addressed. The issue of not having access to, medical doctors. You go to rural areas, that's where you feel it much.
Medical attention.
Yes, you get to rural area, you see somebody who has a chemist being referred to as a doctor. I went to the village 2 years ago, and I was talking to my uncle. He said he had pains in the body, and I said, okay, let me see what drugs you have been given. And I saw all sorts of mixture. I said, don't take this. He said, no, he's a doctor. I said, who's a doctor? He's the one chemist. Because he doesn't have access to
What you call chemist is simply a patent medicine store.
Of course, you know. So he now said that is this guy who gave me this, and even though I convinced him that look, this mixture cannot be good. I'm not a medical doctor, but I don't think this mixture will be good for you. He didn't obey me. He just felt out. So far, that young man had told him that was what he should take. He just had to take.
Yeah. So what one phrase that comes to mind is self-medication.
Self-medication, yes.
So it boggles the mind. So Nigerians should really be worried about this trend.
Yes. We really should be worried. All the signs are there that in terms of delivery of medical services, we are not where we should be. We talked about the primary health centers. Each of the primary health centers should actually have a medical doctor on duty.
Yeah.
But the truth is, in a lot of these primary health centers, is what you call auxiliary nurses or other categories of nurses that are actually taking charge. The doctors have left for the tertiary medical centers, and those tertiary medical centers are actually supposed to be even centers of research, centers of excellence, and centers for research. But because people have, because many doctors would rather not work in the rural areas, you can see that delivery of Medicare is actually suffering in those places.
Yeah.
And also, we need to...
Sorry, is it old school to talk about dispensaries at this point in 2022?
I don't think it's old school, as long as we keep medical professionals who can take good care of people in those
rural
places.
setting. Yeah.
Yes. You see, people travel several kilometers just to be delivered of their babies. And in some cases, they experience stillbirth. Some even die while being taken to medical centers far away from where they live. We need to build more medical facilities across our country. Every ward, for example, every political ward should have a medical center, whether it is primary health,
or secondary.
Yes, you need to have, and where you have primary health centers, they must have a consultant or a senior medical practitioner who can attend to the basic.
Most of these health problems are avoidable.
Yes, a lot of what kills our people are avoidable. Diseases that you can easily treat, but because people do not have access to Medicare, we lose them.
Theophilus, it's Nigerians would wonder what are the basic reasons that prompt health workers, especially doctors, nurses, and midwives, as he said, to want to practice outside our country.
Sir, the phrase that describes it appropriately is what we call brain drain. That is the classic case of brain drain. As at 2017, the number of Nigerian doctors practicing in the UK was 5,060. As at 2017.
And still counting.
Now, as at 2022, it has jumped to 9,976. I'm talking of medical doctors, qualified medical doctors. Then we talk about midwives and nurses. As at 2018, we had 2,796 midwives and nurses in the UK. They were certified to work in the UK. But as at 2022, sir, we have 7,236 Nigerian midwives and nurses. So there's no other thing, there's no other way to describe it other than to say it is brain drain, classic sense of brain drain. Because these guys, to get a medical degree is tough. If you train your child in a private university, you are spending a lot of money. So universities are taking as much as 3 million, 3.5 million in Nigeria.
Per session.
Yes. And if the government trains one medical doctor in Nigeria that spend millions of naira. I think annually, I think about 1.2 million dollars is spent on training Nigerian medical doctors. We graduate about 3,000 of these every year. But then, in spite of the fact that we have private hospitals, even governments are setting up universities of medical sciences. The government are setting it up. Then we have many Nigerians who are going abroad to study medicine and they return. But then the number keeps decreasing. And the fact is that parents spend their resources, government spends a lot of money to train these medical doctors, but we allow them, to go, to other parts of the world to practice.
Do you remember a particular minister who is a medical doctor said we had enough medical doctors in the country? Was it just bluffing?
Definitely. You mentioned it earlier. 24,000 medical doctors to treat 260 million Nigerians. We don't have enough. Actually, government has been talking about remittances. They say when these guys go outside Nigeria and they work, they bring money, dollars to Nigeria. But the figures are not supporting what they are saying. As at 2010, 5.50% of Nigerian GDP came from remittances. But as at 2022, it had dropped to 4.4% of the GDP.
Why?
So, because even when they get to those countries, how much will they send back? They have to live. They must survive. You must pay your rent. You must pay your tax. You have your family must pay that.
High.
So, cost of that argument that when these guys travel out, they will bring money to Nigeria to develop this. It doesn't happen.
Yeah.
So,
yeah. Jide, they say statistics are no substitutes for judgments, but then 10,000 patients to one doctor is alarming. And what would you say is the implication of this?
Well, it's just clear that springing from this, a lot of our people will not have access to Medicare, and that is why people are losing their lives due to ailments that are easily treatable, ailments that shouldn't take people's lives, It's not in the rural areas, in the hinterland, for example. You find that there are not enough medical, not enough health centers, and where you have them, as I've said earlier, medical doctors are not available. They've gone to the tertiary, to work in the tertiary medical centers. So, because the conditions in the hinterland do not encourage them to want to stay, and the bulk of our population is in the hinterland. Not everybody can live in urban centers, So, if it continues along this path, a lot more of our people will keep going down to ailments that are easily treatable. Because access to Medicare is not there. We must democratize access to Medicare. We must make it available to the teeming mass of our people. And the way to do that is to ensure that we build as many primary health centers as possible. Take them to the nooks and crannies of our country and ensure that at the apex of that primary health center is a medical doctor
in charge.
Yes, that's the way it should be. Not a nurse, for example. Yes, we should have a medical doctor at the apex, supported by nurses and other support staff.
All right, then. There's a lot of toing and froing by politicians across the country. I hope they are listening to us. We'll take a break now, go for commercials, and we'll be back. Please don't go away.
Every major news story is with many perspectives and layered with different levels of impact.
Honey, what time did this happen? We will be right there.
At TV's News, we follow the big and major news, gathering the facts
invite you to join me and my host, the Governor of Imo State, His Excellency Governor Hope Uzodimma, at this conference and the retreat for senior police officers.
Theme: the imperative of a Nigeria Police strategic plan for peaceful elections.
The government of Imo State is pleased to host the conference and the retreat for senior police officers in Imo State.
Special guest of honor, President Muhammadu Buhari, GCFR, President and Commander-in-Chief of the Nigerian Armed Forces, Federal Republic of Nigeria. Special guest, all state governors, distinguished senators and honorable members, Minister of Police Affairs and other honorable ministers of the Federal Republic of Nigeria, National Security Advisor, Secretary to the Government of the Federation, Chief of Defense Staff, Service Chiefs and Heads of Security Agencies, Chairman, Independent National Electoral Commission, Chairman and Presidential Candidate of all political parties and civil society organizations.
I welcome President Muhammadu Buhari, GCFR, the Inspector General of Police, senior police officers, and other special invited guests to Imo State.
Date 31st October to 2nd November 2022. Venue: Landmark Event Center, Owerri, Imo State. Time 10 a.m.
Join us.
The D-Day is here, and it's happening in Ukari, headquarters of the ancient Kwararofa Kingdom. The new Aku Uka, His Majesty Elder Manu Ishaku Ada Ali Mataki Tsoin, will formally be presented with the staff of office. The ceremony will be performed by His Excellency Architect Darius Dixon Ishaku, CON, Executive Governor of Taraba State. General T.Y. and Juma retired, GCON Abunta Ukari is the special guest of honor. Date: Saturday, 22nd October 2022. Time: 10 a.m. Venue: Government Secondary School Ukari Playground along Ibi Road, Ukari, Taraba State. Announcer, Publicity Committee.
All I do is win. I wake up, I win. I close my eyes and I win.
We got a emergency, girlfriend.
Keep up with me, come on, let's go. Keep running till the world stops spinning. Independent women, come on, now let's get it. I'ma keep running till the world stops.
Wow, you look great. Did you just come from the salon?
Darling Superstar, grades that stay salon fresh no matter what.
The federal government, through the National Primary Healthcare Development Agency, announces the availability of COVID-19 and childhood vaccines nationwide. With the disturbing increase in reported cases of COVID-19 infections across Nigeria, protect yourself and loved ones from the harmful virus by getting vaccinated. Visit the nearest public or private health facility and mass vaccination sites today to receive the first, second or booster doses of COVID-19 vaccines. COVID-19 vaccines are given to persons 18 years and above, including pregnant women and breastfeeding mothers, while childhood vaccines are given to children from birth to 5 years for protection against polio, hepatitis, yellow fever, measles, meningitis, and other vaccines-preventable diseases. All vaccines are free, safe and effective. For inquiries, visit www.nphcda.gov.ng or call 0700-220-1122.
This message is from NPHCDA in partnership with the Center for Democracy and Development, CDD, with support from our
All right, then, welcome back. So let's continue our conversations. Theo, you've done some work on this disturbing trend, but how pronounced would you say the access to doctors in the rural areas are, or is?
It's quite serious. It's quite serious because in many medical health centers, in many general hospitals, you don't have doctors. I have an experience that, every time I remember that, it's like I should start shedding tears all over again. In 2012, my father needed oxygen. He was in the house and he was gasping for breath. He needed oxygen. The health center next to my village, there was no nurse there. I went to the general hospital, there was no doctor. And when I got the doctor, I called him, please, and he said, look, you are talking about oxygen. You are joking. We can't get any oxygen here unless you take him to somewhere, maybe Makurdi Lokoja, maybe to get oxygen.
Meanwhile, time is of the essence.
Of course, he lost his life that day. We lost him that day because there was no help. You know, it's as serious. And I was 2012. It's worse than, that today. I look at various data that we have. You know, Nigeria, if you look at maternal health, Nigeria is worst in the world. You know, 10% of maternal deaths globally is in Nigeria. That means that women who don't have access to the kind of medical care they need, maybe before, during, or immediately after childbearing. It's 10% globally.
These things
today
are avoidable.
And these are avoidable. These common. Midwives can help, nurses can help, but they don't have access to midwives and nurses. And I want us to be very clear-minded about this. When we talk about healthcare, it mustn't be gigantic hospitals that politicians build and commission with fanfare. You know, we need, even if the hospitals are not really big, let there be equipment for investigation. Yeah. You know, because some persons may just have headache, you know, and then you start treating them for typhoid because there's no proper investigation.
So it brings to mind misdiagnosis and so on.
Of course, and that is one of the causes of death in Nigeria. You know, at times somebody will be treated for maybe cancer in Nigeria. By the time he gets to maybe Europe or even Middle East countries, they'll say, no, you don't have cancer. What you have is maybe one pain in one part of your stomach. They administer a kind of treatment. Then that's it.
Just like Ganefa was being treated for pneumonia and cancer. Until his daughter came to take him to the US. By the time we got to the US, they discovered that the level of remission was already a big problem. And that was how the man died.
So I think we should emphasize investigation and quality medical personnel, because as long as we don't have medical doctors in rural areas, people will just keep dying. And we shouldn't say that Nigeria's population is too much so people can die. No, it shouldn't.
Because India comes to mind, 1.3 billion people.
Yes.
And Nigerians prefer to go there.
Sir, India has 1 doctor to 1,000 persons. In India, 1 doctor to 1,000.
They met the...
So they meet the world standard. 1 doctor to 1,000. But in Nigeria, you're having, 24,000 to 216 million. If you look at that, one doctor is treating about 10,000 persons in this country. Yes. It doesn't work. Even if you go to Philippines, if you look at migration of doctors from their home countries to UK or to Europe, you see Philippines is highest, but Philippines has 1 doctor to 1,000 patients. India is second.
Medical colleges are turning out doctors.
Yes, sir. India has 1 doctor to 1,000. You know, so if you go to India, it doesn't. It's not difficult to train a doctor in India.
Yeah.
But in Nigeria, things are made difficult. Things are made so difficult. There are no equipment. The political will is not even there. People have to struggle through. And you see, we need to ramp up. You know, the number of doctors we train in Nigeria and make deliberate effort to retain them. Yes. If we don't make deliberate attempts to retain them, we'll continue to have this problem.
It will get worse.
Every medical doctor wants to fly out.
All right, Theophilus, happily, there's a medical doctor who will join us now. Tokumba Otitoju is his name. Don't ask me if he's related to him. He's joining us via Zoom. Dr. Otitoju, greetings. How are you?
I'm fine. Thank you very much.
Okay, then. Your colleagues are jetting out, so what are you waiting for?
I think that at this time, I really can't. I think I cannot just pack my bags now and say I want to leave. I have established a career path here, and I won't say I'm very comfortable, but I enjoy what I'm doing. I know this is not the case with everyone out there, and I understand the reasons why they are leaving the country.
Yeah.
But for me, I know that some of us have to wait behind and build. for those of my friends who have left, they are still very much interested in Nigeria. We talk every time, but they need to just forge a career for themselves. Time waits for nobody. Before you know it, you are in your 50s, you are in your 60s. You look at yourself and start questioning your decisions. So I know a lot of them will come back much later because we are always in touch. The one thing the government must also know, and everybody must know, is that as Nigerians, some of us love this country very much, and we want the country to work. A lot of my colleagues want the country to work, and they are always in touch with me. They ask me questions. They also ask what they can do, even from where they are. So I know that it's very tough, but for me, I have to stay back and build.
Oh, tell us some of the reasons why your colleagues are jetting out to the UK, the US, Dubai, Australia, and other places. Why are they leaving?
Yeah, so the reasons are because of the challenges in the healthcare system and inadequate funding or inadequate training seats available for them, for those who graduate and want to specialize and further their career. It's extremely difficult to get residency seats out there. Poor remuneration, of course, but even the remuneration aspect is really not a major thing driving them out of the country. They need a proper place to work, they need a proper place to build, to grow and build their career. For a lot of my friends who left Nigeria, the remuneration part was even secondary. It's just that they don't want to be stagnant. They want to grow. They want to become the best in their field. And you cannot be the best in your field, in your area of expertise, if you cannot train, adequately, especially in hospitals where you have the latest technology, you have the latest advancements, research and development. I mean, the knowledge base that is required. So that's what is driving a lot of them. If you compare the training system in the US, for example, we are exposed to a lot of things. I mean, all of us can bootstrap through medical school, do our house job and NYSC, but it gets to a point where you become a global citizen because you are competing with your colleagues all over the world, and you don't want to be caught up in any old system where you don't even understand how the latest healthcare equipment work. So, for them, they want to be exposed to that world that will make them the best in their chosen area of expertise.
Yeah, but as we sit here, it's the political season, and the politicians are listening to you. What do you say to them in this regard?
So it's more of a policy thing. We have to be clear on the type of system that we want to run. Nigeria is poor in terms of revenue. I always say that, but we have lots of resources, human, natural resources, and everything that we need to develop this country. We also need to understand that healthcare is very expensive. It's not cheap in any part of the world. You have the NHIS with about 153 billion pounds in healthcare budget, and the NHS is still struggling. They have backlogs of appointments to meet. They are scouting for doctors all over the world. But Nigeria really budgets above $2 billion, for example, for healthcare. Australia has about 30 million citizens. Their healthcare budget is almost over $100 billion, while Nigeria is still struggling with $2 billion healthcare budget. So how is healthcare funded? Government alone cannot provide these resources. We don't have health taxes in Nigeria, so our income isn't taxed for healthcare. We don't have proper health insurance system. Although the president has signed the Compulsory Health Insurance Act, that's also a source of funding for healthcare. And then we cannot look at other sources, donor funds and all that. So we need to build a system that we can adequately fund. We need to jettison this idea that there is money somewhere and we can fund 74 teaching hospitals in Nigeria and all of them will be properly equipped. No, it's not going to happen. We don't have that resources. We need to mobilize funds from either taxes, health insurance, donor funds, private sector collaboration, and all to build the kind of system that we want. We cannot, this socialist era is over. And for those people who believe that healthcare should be strictly funded by government, it will take a miracle for Nigeria to be able to fund healthcare for 200 million people. We don't have that capacity right now. And the longer we delay this thing, the more problems we will face.
Yeah,
we've not been able to do this thing for almost 5 decades since we started in the 50s. And where we are today, still running the same problem. Nigeria has huge subsidy on healthcare. I've never seen any country in the world where we have subsidy on tertiary education, subsidy on petrol, subsidy on loans, subsidy on agri, subsidy on healthcare. It's going to end up, same thing with our power situation and university situation. If you cannot fund it, then if you subsidize it, what you will get is a poor system. So we need to understand that we cannot fund healthcare and we need to mobilize resources from taxes, from health insurance. Specifically, health insurance is very important, and then of course from private sector participation.
All right, Dr. Titoju, we must go on another commercial break, but thank you for your time. Hold it there, we'll come back to you. Thank you.
Good afternoon, sir. Please, I need a room to rent in your house.
Okay, where do you work?
I'm a nurse.
That means you won't owe me rent. Congratulations, young lady. You have yourself a house.
Well, thank you so much, sir. So, how much is the rent?
90,000 naira. Oh, but wait, where are you from?
I am from Akamata.
Akamata what? Akamata in my house? If you know how you got into my house, please get out right away. My spirit and that of Akamata people don't have anything to do together.
Sir, what have I done?
Your people from Akamata are known for bad things. That is what they represent, and you can't live in my house. Just get out right away.
What's going on?
Leave my house, young lady. Yes, our differences extend to our languages, culture, food, and even belief. But we are bound together by the cord of love. With one heart, with one voice, we will make Nigeria a hub of greatness, a place where the people live as one.
This message is brought to you from the Center for Democracy and Development, CDD, with support from the UK government.
Okay, welcome back. If you have just joined us, we have this story, very disturbing. The Nigerian Medical Association, NMA, says only about 24,000 medical doctors qualified are having to deal with more than 200 million of us in this country, and that's something troubling. So you are, at this point in time, you are wondering what the state and federal governments can do.
Yeah, there's a lot that they can do. We need to produce more doctors and fund those medical colleges. India has 479 medical schools, and every year the average intake is 67,000 medical students. Entering for the MBBS.
Yeah.
So this has helped them to meet that WHO ratio of doctor to the population. And I know that we can get there too if we work hard. Let's build more medical centers, build more medical schools, to continue to produce enough to take care of our population and do our best to keep the ones that are here. There should be incentives for medical doctors to remain, to work in the hinterland, in the rural areas. I remember that a state like Jigawa tried it some years back. Just give them some incentives, and you start to do that for the junior doctors, for example, level of NYC, those who want to stay in the state and work, you give them the incentive to make them remain in that state and work. And those who want to stay in the hinterland and work there, you also give them the incentive.
Essentially,
and provide the tools.
The work environment must improve.
Yes, even quality tools that you work with is part of work environment. Provide what they need to do the work. That will encourage a good number of them to stay.
Definitely, it's only natural to ask at this point, do you think these emigrations are for money's sake?
I think Dr. Titoju, answered that question, elaborately. Specifically, he talked about career progression. Say, look, if I'm a medical doctor and I don't have access to facilities, I don't have access to modern development in my field, I could be on my way out. I would be seen as an old school doctor when my parents in other parts of the world are moving up. We have this case of one hospital in a part of the north where we conducted this research. In that hospital, there was only one urologist. He was the only urologist attending to every urinary tract infection in that hospital.
Wow.
So you know what happened? He just left.
Pressure.
He left. Not just because of pressure, but he felt he was not enjoying, job satisfaction. He had to go to other parts of the world where he has access to facilities for investigation, where he could rub minds with those who are in the same field with him. So it's not just a remuneration, but then it's part of it. There's trust deficit between health workers and government. Yes. We spoke to a medical doctor who said, look, all the promises that government has made to us, about hazard allowance, special allowance, government never kept those promises. And then even the minimum wage, the way it was implemented in their own state, his own state was laughable. So, you see this half-heartedness, lack of political will in facing, the issues. And like Dr. Titoju said, I want to also emphasize that if government knows, and it's becoming clear to us that government knows that it can't fund health, it's good for us to sit down and say, what else should we do?
Yeah.
Because if you can't make health available free to Nigerians, then why don't you now sit together with all stakeholders? As this thing cannot be free, how do we implement insurance? How can we get foundation, not the organizations to come in? How can we ask companies to come in? Because in Nigeria, it's a signatory to 2001 declaration, Abuja Declaration, which was to say 15% of the budget should be dedicated to health. It never happened. It never happened. Because even Nigeria's budget is not enough for any, like he was talking about, Australia budgeting $100 billion. Nigeria's budget for 2023 is just $43 billion. When we hear 20 trillion, it amounts to only $43 billion, which is not up to
you are the one converting it.
Of course, we need to convert it to know where we stand. In other countries, even like South Africa has about $101 billion as its budget, and it's only about 50 million persons. So you see, I don't think we are realistic, in our plans, and that is why I'm advocating that we must ensure that we have data, for making policies.
Yeah.
If we have the data, we know that, look, what we are planning for Nigeria is not realistic. We now say, okay, based on this data, what should we do? And we have to face the fact.
Jide, you talked, even if in passing, about medical schools in India. Let's talk about our country. There are medical schools here.
Yes.
So are we thinking about equipping them and upping the ante in terms of training?
That's what we should be doing. I still believe that we produce quality medical professionals here, because when they go to the UK, the US, they still sit for some exams there, before they can be qualified to practice, and they excel. So if they are excelling in those places and they are being licensed to practice, it must be because they are good enough. So the medical schools here must be good enough for people to write exams to work abroad and for them to succeed. It means that those schools are good. I know how grueling the process can be to train a doctor here. And that's why it's painful that despite all that the country spends to train the doctor, we can't even keep them. They all want to go.
What a
and
shame.
even nurses too, and midwives, they're also living in droves. The level of immigration of doctors from Nigeria is the highest in Africa. You know, it's really troubling. Highest in Africa, and I think the third highest in the world. That's nurses. So it's not even doctors alone that are living.
And I hear they are highly priced outside of our country.
Yes, that's the point that I'm making. It must mean that they are good. And their sense of industry must also be good.
That's it.
For people to take them seriously.
But just before we go back to our friend Dr. Tokunbo Otitoju. Dr. Otitoju, are you there?
Yes, I am.
Okay, let's ask this natural question. Are we fighting a lost battle? Is it too late to redress the situation?
No, it's not too late. We just need to embrace a policy that works for us. I mean, there's no need to go the populist route of trying to sound or behave like a government that wants to be popular at all costs. There are some things that at this point Nigeria cannot afford. The government cannot afford to provide quality healthcare services because the resources are not there. We need to find a way to ensure that health insurance works. We need to find a way to increase taxes.
Thank you, Dr. Otitoju. I must stop you here. Time is tight.
Okay.
Time is tight. But many thanks for your time. Theophilus, quickly, is it too late?
It's not
in one sentence.
It's not too late, but I emphasize the need for us to engage in research. Like this research that we did, the partnership with the research.
Okay. The research you conducted.
Yeah, the research we conducted by DRPC. You know, is funded by Bill and Melinda Gates. You know, and you know, if Nigerians were, putting money into research, you know, we'll get more details, more information that will help us to do proper planning.
Gideon, and to you, is it too late to start something new?
No, it's not too late. This is the best time to begin to address this problem. If we wait until it's too late, then it will be bad. We need to begin to address this problem now, and this is not an insurmountable problem.
Yeah, because Nigeria is a country of well-meaning people, you know, very, very, very professional people. All right, health is wealth, they say. I know that this is a country that's brimming with so much religious fervor. Yes, God heals, but the doctor takes care. Let's take care of the doctors. I think that's our program for the evening. I want to thank you very kindly for your time, but not before asking that you join us at 11 later tonight if you miss this particular broadcast. And to also tell you we are on, what do you call it now? We are available on YouTube. We are available on YouTube. Please join us. I'm sorry, I tended to forget what we do here. We are available on YouTube, youtube.com/TVC News Nigeria. And so on behalf of the Backroom Boys, this is yours sincerely saying thank you for staying with us. Bye-bye now.